is a time for fun in the sun, and for many, that can lead to serious sports injuries. Here to explain how to prevent and treat those problems, please welcome back ABC News Chief Medical Correspondent, Dr. Tara Narula.
Hi.
Okay.
All right, let's start with twisted ankles and sprains.
Yes.
Very common, yes?
Very common. So this is actually one of the biggest reasons that people see their primary doctor, go to the emergency room. Actually, the most common injury in organized sports. And so when we talk about an ankle sprain, we're usually talking about the ligaments that surround the ankle bones. Usually the lateral or outside aspect, they either get stretched or partially torn or completely torn. So there's sort of a gradation there. And it happens a lot when you kind of land awkwardly, you're running or walking on uneven ground, you're not wearing the right shoes. And we see it a lot in court sports. So tennis, pickleball, but also soccer, football.
What is it? I've heard this so many times by people that will be in like an air cast or a splint or a brace of some kind, and they say, the doctor said it would have been better if I had broken it. Is that true?
No. I mean, it's never true. You never want to break a bone.
Okay. You never want to break a bone.
No, never want to break a bone.
So a sprain is not as severe
It's not as severe. And usually it's treated with, we call it the mnemonic RICE, rest, ice, compression, elevation. So rest, icing it, compressing it with some sort of elastic bandage, and elevating it to relieve swelling. Medications like Advil, Motrin, Aleve, Tylenol, physical therapy. And
Xanax.
Maybe,
Just kidding.
maybe for some. And then there are some strengthening exercises. So kind of standing, lifting your heel, lunges sideways or forward, and actually balancing on one leg can help with that.
Tendonitis, I know this well.
Oh, so do I. I had elbow tendonitis last year, and it's pretty painful. So
I don't know what tendonitis is.
So tendons are the thick cords that attach the muscle to the bone, and it's either an inflammation or an irritation of the tendon, and it happens a lot with repetitive activities. So we think about it with tennis elbow or golf, or things where you're moving that muscle and joint over and over again. We see it with all different kinds of sports. So it can be shoulder, wrist, ankle. You can think of Achilles tendonitis, for example, in runners, jumper's knee, and people who play basketball or volleyball. And really the treatment also is going to be that RICE. Sometimes you'll get a steroid injection, physical therapy, usually doesn't need surgery, and really avoiding those aggravating activities that exacerbate it, and cross-training, so you're not using the same muscles over and over again.
This is a scary one. Injuries to your ACL.
Yeah, ACL is a big one. About 200,000 ACL injuries happen every year in this country, and this is the really important ligament that sort of stabilizes the knee joint. And so we think of it as a pretty serious injury, and if it happens, there is a scale of really needing potentially long-term rehab, sometimes even surgery to treat it. We think of ACL injuries happening in those sort of moments where you're running or pivoting and you suddenly stop and change direction. That tends to kind of tear the ACL. Also, if you get hit directly in the knee. So we hear a lot about ACL injuries in football, basketball, soccer, even tennis as well. And sometimes you can treat it non-surgically, but really sometimes if you want to get back into competitive sports, you do need surgical treatment for the ACL.
Is there an MCL?
Yes.
Yes, there are.
Okay, because I hear that
Yes.
word too.
There is. Medial collateral.
Okay, thank you. Look at me go. So a lot of injuries are head injuries. You know, people are on their bikes or what have you. What about concussions and head injuries?
So concussions are actually a form of a mild traumatic brain injury. And really what happens is the brain is shaking in the skull, either because it directly gets hit or your body gets hit and it shakes your skull. And we see anywhere from 1 to kind of 3.5 million concussions every year. If you play a contact sport in that season, your risk of getting a concussion is about 20%. The important thing with concussions is really to identify it quickly, remove the player from play, and you want to give them rest. So mental rest, so no reading, on your phones or devices, really slowing down your mental processes, and also physical rest. Sleeping well, hydrating, eating well, and then slowly returning to activity over 24 to 48 hours. Easy things like stationary bike or walking. Most people will recover, and really prevention centers a lot, Kelly, around helmets.
Yeah, right.
Talk a lot about
of course.
Dr. Narula, I had mallet finger one
yes.
year.
Let's talk about this because
It was not painful at all.
He suffered.
It wasn't painful, but it was
No?
very strange.
It doesn't
went,
look good.
It just went like that. Jammed fingers and finger injuries also big, yes?
Very common in the summer if a ball hits you on end, the finger moves or bends to one side. I was just telling you, my daughter was riding her bike.
Yes, oh my
in our
gosh.
yard, fell. She's 10 years old, came running over to my husband and I, and her thumb was completely bent out of place. Dislocated. My husband, who's a surgeon, actually said, go run, get a towel so she doesn't see it.
So he doesn't see it.
He didn't want to see
Yeah,
it.
he didn't wanna
I
see
took her
it.
to get it fixed. They had to push it back in place, and he couldn't watch. So very common finger injuries.
I love that your husband, the surgeon, couldn't
He
watch.
couldn't watch.
I know, it's amazing.
He said, "It's my daughter. I can't see it." I said,
Yeah.
"But I was holding her. Well, she's
Right,
my
of
daughter
course,
too."
of course.
I get it.
Yeah.
I get it. And rotator cuff injuries?
Yeah, so rotator cuff, my husband had this actually last year.
Okay.
So these are the kind of muscles and tendons that surround the shoulder. It's a group of them, and they help us to lift and rotate our shoulder. And we see this a lot, again, with the wear and tear repetitive overhead motion. So you think about swimmers, you think about tennis players, pitchers, football players, anyone who's doing this motion again and again. And really, this is, again, something that can be treated mild with non-surgical treatments sometimes. But if the injury persists, you have pain or instability of the shoulder, some people do really require surgical treatment for that rotator cuff.
Thank you so much for all this information.
Yeah. Go to our website for all these great tips and more. We'll be right back.